Hi, this is Manos Brilakis, and this is case 136 for the Manual of Percutaneous Coronary Interventions. This is a case of periprocedural stroke. The patient was a middle-aged woman that presented with non-ST segment elevation myocardial infarction. She underwent coronary angiography that did not show any significant disease in either the left or the right coronary artery. The patient had left ventriculography that showed normal left ventricular systolic function. There was no evidence of Takotsubo. The procedure ended. However, the patient complained of mouth drop. She had slurred speech as well as left-sided weakness. So what to do next? We did call for an emergency neuro code, which is the standard process in our lab. This is the protocol for any patient who develops neurologic symptoms during or after a cardiac cath procedure. Neurology emergently came, evaluated the patient, and ordered an immediate CT of the head that was negative for intracerebral hemorrhage. And the patient subsequently was given TPA. She did have improvement of symptoms. She subsequently had an MRI that showed very small acute infarctions involving the right basal ganglia and the external capsule and the left occipital cortex. The patient subsequently had improvement with resolution of the neurologic symptoms. There are several lessons from this case. The first one is that neurologic complications can happen during cardiac catheterization, which emphasizes the importance of a strong indication for the procedure. Cardiac catheterization is an invasive procedure that has complications, as stroke is one of the most feared potential complications of the procedure, but fortunately the overall incidence is very low. The second main lesson is to have a protocol in place. So if a patient develops neurologic symptoms during or after cardiac catheterization, there should be a pre-planned course of action. There should be a protocol in every lab. In our lab, the protocol is to call for an emergency neuroconsult. The neurologist comes in the cath lab, assesses the patient, and determines the need for a CT scan and the need for TPA or for endovascular intervention, as happened in our patient. Thank you very much.